Hello, welcome to another episode of What the Health. So today we are going to be talking.
Coming through. I gotta go potty.
Well, that was Tinkerbell, and that's timely because today we're going to be talking about urinary tract infections, and I think she might need an appointment. So here I have, of course, a diagram of the anatomy for males and females. So first we have our kidneys. We have two kidneys, and those filter waste products from our blood, and from our kidneys that's then turned into urine. The urine then passes through our ureters and it goes down to our bladder, and our bladder is a storage pouch for urine. And then when we have the urge to urinate, then the urine passes through our urethra out of the body, hopefully into the toilet. And when we look at the anatomy of the female compared to the male, you'll see that there is some differences here. And females are more prone to urinary tract infections than men, and the anatomy plays a big role in that. So the female's urethra is quite a bit shorter than the urethra of the man. Also, the female's urethra is located in very close proximity to the vagina opening, and the female's urethra is also much closer to the anus and rectum, which is where stool or bowel movement passes out. So there's much likely contamination from those other openings for a female, where it would be less likely to get contamination there from a man. With infections, we have two different types of categories of infections. We have upper urinary tract infections and lower urinary tract infections. The upper involves the kidneys and the lower involves the bladder area. Primarily, the most common really are the lower bladder infections. Medically, we call those cystitis. And symptoms of those infections would be, like you saw with Miss Tinkerbell going through the hallway, feeling that need to urinate frequently, and that you need to urinate urgently. So you just need to get to the bathroom quickly, you need to go. The sensation maybe that your bladder is not emptying completely, and that you might have some burning when you urinate. And sometimes you even see that there might be blood in the toilet in your urine with urination as well. In cases where it affects further up into the kidneys, then at that time you might have some nausea, vomiting, you may run a fever, as those are more complicated and complex types of infection. We certainly treat urinary tract infections at the Student Health Clinic, and that's something that we see fairly commonly here, especially in women. So if you feel like you're having symptoms, call and make an appointment. What we do first is we try to get a urine sample from you. And with that urine sample, we do a test called a urinary dip test. And we're looking for specific indicators in your urine sample to see if it's showing signs of infection. Ideally then, the urine is sent on for a culture, and that culture isolates down what specific bacteria is actually growing in your urine, and then a sensitivity can be performed where different antibiotics are tested against your specific urine sample to let us know as providers what antibiotic is working for you. Urinary tract infections can sometimes mimic a sexually transmitted infection, so it's important to be looked at to see if it's one or the other. Urinary tract infections are generally treated by antibiotics. Antibiotics are the best treatment, but there are other things in your lifestyle that you can do to help move the process along. So what can you do to prevent yourself from getting a urinary tract infection? There's not a lot of great evidence of what really works and what doesn't, but there are a few things that do show good credibility. For the simple urinary tract infections, the more common ones, people who aren't getting them recurrently, it is well proven that drinking lots of water is a good preventative. And there are studies that have shown that for people who have gotten urinary tract infections, sometimes they can be turned around early on just by really increasing water intake. But I will say along with that when somebody gets a urinary tract infection, they're usually in the clinic being evaluated within 24 hours. It's not comfortable. So I wouldn't give the increased water a lot of time. There also is evidence that the urinary tract infection is, yes, a result of increased amounts of bad bacteria in the system, but that it's also a lack of the good normal bacteria that is supposed to be in our bladder and in our urinary tract. And so there are probiotics that can be taken, and they can be used orally, which does have some good evidence that that might be beneficial, but also they can be used vaginally for women and topically, and those can have good effect. For women who get urinary tract infections that occur right after sexual intercourse, after a good evaluation, there are sometimes antibiotics that are prescribed that can be taken within 4 hours after sexual activity, and that can stop them from getting recurrent infections. Cranberry. So a lot of people say, hey, I've been drinking a lot of cranberry juice, or I take over-the-counter cranberry tablets. There is some evidence behind that, and also in regards to taking vitamin C. And that has to do with the membranous wall of your bladder and the way that bacteria can stick to that lining and compromise that lining. And so there are some types of bacteria that bind to that wall of the bladder, and cranberry has a component to it that makes it so that they can't do that as well. So that can be beneficial too. Thank you for joining me for another episode of What the Health. Please continue to send questions and comments to the Student Health Clinic. And again, no topics are off the table. We're happy to be able to help you and happy to bring you these episodes and answer some of your questions.